Imagine this. You're in a small, dimly lit room, a soft leather couch, a ticking clock, and a stranger in a sweater with a notepad. You've been told this is where healing begins, but something feels off. Not because you fear opening up, but because deep down something tells you the problem isn't you at all. You're not the only one drowning. Outside that door, the world is burning. Loneliness is epidemic. Anxiety is normalized, numbness is survival. And yet, when you come in here, the questions always circle back to you. Your coping mechanisms, your childhood, your maladaptations to a world no one adapts to well. But what if you're not sick? What if you're sane in an insane culture? What if therapy, for all its value, has become a sedative for a civilization in crisis? What if it teaches you to adjust to dysfunction rather than rebel against it? What if healing, in its modern clinical form, is just a velvet prison, a place to process your pain while the machine outside keeps turning uninterrupted? And who benefits when your suffering is treated like a personal flaw rather than a political, cultural, or spiritual wound? What if the therapy room isn't where truth lives, but where truth is neutralized? The question isn't whether therapy helps. The question is what it helps you to become. And that's where the real story begins. The great lie of modern healing is that all suffering originates inside the individual. The moment you walk into therapy, society evaporates. Politics, power, culture, and structural violence are dissolved into a haze of clinical diagnoses. Your anxiety isn't a response to late-stage capitalism or the alienation of modern life. It's generalized anxiety disorder. Your deep existential grief isn't a rational response to spiritual emptiness. It's depressive disorder, recurrent, moderate. You are not responding to your environment, they say. You are malfunctioning within it. Thomas Szasz saw this decades ago, and he called it what it was, a myth. A myth that transformed moral, social, and political conflicts into mental illnesses, reframing rebellion as pathology and turning anguish into paperwork. Sasz's warning wasn't against therapy per se, but against what therapy had become, a mechanism of social control masquerading as care. In his words, the psychiatrist's role is to persuade the patient to accept society's judgments. And if society is diseased, well then the goal becomes adjustment, not liberation. Carl Jung saw something similar. He called it the great forgetting of the soul. When a person is wounded, they don't simply need analysis. They need meaning, not symptom relief, but symbolic reintegration. But meaning is dangerous in a world that thrives on obedience. So instead, we pathologize deviation. We treat existential pain as a chemical imbalance, not a spiritual alarm. And this suits society well. Because a society built on productivity doesn't want awakened individuals, it wants functioning units, workers, consumers, cogs who feel just well enough to keep going. And so therapy becomes a form of psychic domestication. You come in wild and burning with questions. You leave pacified, medicated, and coached into emotional regulation techniques. But what if emotional regulation in a toxic world is not health, but complicity? Nietzsche, for all his ferocity, never hated suffering. What he hated was false cures. He believed that most modern morality, including what passes for psychological well-being, was designed to tame the human spirit, to castrate it. In the Genealogy of Morals, Nietzsche argued that society transforms natural instincts, anger, lust, grief, into guilt, shame, and self-surveillance. In this framework, therapy often functions like the priesthood once did, redirecting your rage inward until you blame yourself for not thriving in a graveyard. And yet, when your mind screams at 3 a.m., is it truly a malfunction? Or a signal from something deeper, your soul rejecting the lie? We have in effect created a world where people are expected to be mentally healthy in unlivable conditions. We measure success by emotional stability, even when that stability comes from disconnection, sedation, or denial. Aldous Huxley once imagined a world in which every emotion that couldn't be monetized was considered a disease. Sound familiar? Because that world is here. And instead of soma, we have SSRIs. Instead of priests, we have therapists. Instead of confession, we have 50-minute sessions where the goal is not insight, but stabilization. And stabilization in a collapsing society is not health, it's surrender. This is the hidden problem. We've confused adjustment with wellness. We've mistaken compliance for healing. We've placed the burden of emotional suffering on the individual, while the very structures that provoke that suffering remain untouched and unexamined. And so long as we keep looking inward, we won't look outward. And as long as we stay in the mirror, we won't see the cage. But what happens when the mirror starts to crack? When a person senses deep in their bones that their therapy sessions aren't touching the real wound? When they realize their pain is not private but collective, that's when the second wound appears, the one no DSM can name. It's the wound of knowing too much and having nowhere to take it, and that wound changes everything. You sit across from someone trained to listen, to label, to nod. You speak of despair, emptiness, numbness that wraps around your chest like a cold fog. They ask about your childhood, your relationship with your father, your diet, your breathing patterns, all valid questions, all rooted in the assumption that you are the site of the malfunction. But what if the real problem is everywhere except inside you? When suffering is privatized, the system breathes easy, because as long as the war is internal, the world outside avoids inspection. It's not the crushing expectations of hustle culture, it's your self-esteem. It's not the hollow echo of social media's empty validation, it's your negative thought patterns. It's not the dread of climate collapse or political decay, it's a serotonin imbalance. And so the machine hums on, uninterrupted. You go home with a mindfulness app and breathing techniques, thinking maybe if you try harder, you'll feel okay. You adjust your behavior, your thoughts, your routines. You become a project under endless renovation. You become a polished prisoner. The deepest consequence of this system isn't just psychological, it's existential dislocation. Because when therapy is framed as a personal journey, stripped of social context, it alienates you from your most sacred insight, the realization that your pain makes sense. When people begin to feel their suffering is irrational, they lose trust in their own perception. They begin to gaslight themselves. They start believing the lie that if they were only more disciplined, more healed, more mindful, they would be happy. This is the trap of internalized pathology. The more you hurt, the more you assume you're broken. And the more broken you feel, the more dependent you become on a system that quietly refuses to acknowledge the real source of your pain. And there's another layer, a more sinister one. When therapy becomes the default response to discontent, we stop asking political questions. We stop interrogating the structures that demand we commodify every part of our identity. We stop challenging systems that exploit our labor, destroy our environment, and hollow out our communities. Instead, we attend weekly sessions and call that doing the work. But real work, the kind that heals, requires confrontation with the world, with power, with meaning. Jean-Paul Sartre once said, "You are your choices." But what kind of choices are available when all roads lead back to self-correction? When every attempt to scream outward is turned inward and renamed resistance to treatment, even silence becomes weaponized. You're told to regulate your nervous system, to ground yourself, to accept what you cannot change. But grounding yourself in a house that's on fire is not healing. It's delusion. And the cost of that delusion is profound. We become people who no longer trust our outrage, who no longer believe our sadness has wisdom. We become tame, palatable, manageable. We become clients of a healing industry that profits off our endless self-doubt but never invites us to dismantle the cage. The irony, many therapists are themselves trapped. Trained within systems that discourage radical questioning, forced to adhere to diagnostic codes and insurance protocols, conditioned to pathologize pain without permission to name the violence behind it. Even their compassion becomes contained, reduced to method and boundary. And so, without realizing it, therapy in its sanitized, standardized form becomes a mirror of the very society it was meant to protect us from. It's polite, it's efficient, it's careful not to offend. But what if healing isn't supposed to be polite? What if true healing is loud, disruptive, messy? What if it's not about acceptance, but resistance? These are questions the therapy room rarely permits. Because if enough people ask them, really ask them, the entire scaffolding might collapse. But every now and then someone does ask, and when they do, the first crack appears in the wall. There comes a moment, quiet, piercing, when you realize that no amount of journaling, breathwork, or cognitive reframing will silence the scream inside you. A scream that says, this world is not okay, and maybe, just maybe, it's not you who needs fixing. That's the moment of rebellion, not the kind with protest signs or shouted slogans, but the kind that starts in the marrow. The kind that whispers, I will no longer gaslight myself on behalf of a broken culture. Rebellion begins when you stop pathologizing your sensitivity, when you start seeing your grief, your rage, your numbness not as symptoms to be managed, but as sacred signals. Echoes from the soul, begging you to wake up. It's what Viktor Frankl discovered in the concentration camps. The one freedom no one can take from you is the freedom to choose how you interpret your suffering. But even that insight has been diluted by pop psychology and turned into a productivity hack. The truth Frankl knew wasn't about toxic positivity. It was about transcendence through meaning, not comfort through coping skills. To break free, you must first reject the idea that peace comes from passivity. Peace is not the absence of chaos, it is the presence of truth. And truth, in a sick society, is dangerous. So the rebellion begins with questions. What if your depression is a logical reaction to a world that values profit over people? What if your anxiety is the body's alarm system screaming in the face of overstimulation and false connection? What if your maladaptive behaviors are actually acts of unconscious resistance? You don't need a better routine, you need a rupture. You need to exit the frameworks that taught you to mistrust your own instincts. You need to stop asking, how can I be more functional, and start asking, functional for what? For whom? Because sometimes dysfunction is wisdom refusing to cooperate. And this is where Szasz, though controversial, was prophetic. He saw the truth that few dared to say aloud. When madness is the only rational response to madness, sanity becomes subversion. To reclaim your life, you must break out of the diagnostic trance. Step outside the story where you are a problem to be solved, and re-enter the story where you are a being awakening. This doesn't mean abandoning therapy altogether. It means reclaiming your authority within it. It means seeking guides who do not merely treat your symptoms, but who help you uncover the lie beneath them. You may not find them in institutional clinics, but you will find them in books, in silence, in solitude, in art that shatters illusion, in conversations that don't start with what's wrong with you, but with what happened to your fire. Rebellion also looks like reconnection with your body, untouched by clinical language, with the earth outside fluorescent lit waiting rooms, with others outside the transactional dynamics of formalized healing. Because healing doesn't always happen in a session. Sometimes it happens in a kitchen at midnight, in a forest path, in a scream that is finally allowed to rise unshamed. You may cry, you may rage, you may burn old journals and tear up diagnosis sheets. You may stop attending sessions that shrink you and start building rituals that expand you. You may even say no to recovery as it's defined by people who've never met your soul. And all of this is healing. Because healing isn't becoming functional. Healing is becoming whole, and wholeness requires truth, even when it hurts, even when it means walking away from systems that claim to care but refuse to listen. The rebellion is remembering this. You are not a machine to be repaired. You are a story waiting to be reclaimed. And in a society that wants you sedated, still, and smiling, reclaiming your story is the most radical act there is. There comes a realization so sharp it doesn't whisper, it cuts. It arrives not as insight, but as rupture, a tear in the illusion, a sudden knowing that you were never meant to be cured. Not because you're incurable, but because the cure itself was a cage. You were never sick, you were in pain. And pain, in a disordered world, is not pathology, it's prophecy. This is the final truth Thomas Szasz fought to unveil, and why so many feared him. Because he saw what few dared to admit. Mental illness, as it is often defined, is a moral judgment wrapped in medical clothing. It's not that suffering isn't real. Of course it is. But when that suffering is extracted from its context, stripped of meaning and framed as chemical failure or behavioral defect, it becomes depoliticized, defanged, made manageable. And that's the point. Because if your pain is just a personal malfunction, then no one has to change the world. But if your pain is the logical response to a world gone mad, then we all become accountable. And accountability is expensive. So the system offers you pills, offers you coping strategies, offers you 12 sessions and a discharge plan, offers you clinical neutrality that never dares to ask who benefits from your silence. But you're starting to see the cracks. You're beginning to understand that what hurts inside you may be a mirror of what's broken outside you. That your depression is not a diagnosis, but a response. That your anxiety is not a disorder, but an awareness you've been taught to fear. And most radical of all, you're beginning to suspect that the part of you deemed too much, too sensitive, too angry, too intense, is the part that knows the truth. The world is full of people trying to feel normal in conditions that are anything but. The ultimate realization is this: therapy won't fix a broken society, because therapy was never meant to. Therapy in its mainstream form is not a revolution. It is often a system of normalization. It makes the unbearable bearable, the insane livable, the incoherent manageable. And in doing so, it may keep people alive, but it rarely sets them free. To be free, you must risk being seen as mad by those who've made madness their home. You must dare to feel in a world that profits from your numbness. You must dare to not function in systems that treat your dehumanization as success. You must step outside the frame and ask, who wrote this story? Who decided that grief has a timeline? That anger needs to be managed. That sorrow is unproductive. You did not come here to be efficient. You came here to be awake, and awakening hurts, because it pulls you out of the comfortable lie and drops you into the burning center of reality, where healing is not a checklist, not a clinical goal, but a wild spiritual remembering of who you were before the world taught you to forget. So if you feel lost, shattered, overwhelmed, good. It means your soul still works. You're not malfunctioning, you're mourning, you're not broken, you're breaking through. And this breakthrough is not neat, not sanitized, not polite. It won't fit inside your therapist's clipboard. It won't be coded for insurance, but it will feel like truth. Because the ultimate truth is not that therapy is bad. It's that therapy, when divorced from truth, becomes betrayal. A soft betrayal, but a betrayal nonetheless, of your soul's deepest cry for something real. And now that you've seen it, the question isn't whether therapy can save you. The question is whether you're still willing to be saved in the way the world defines salvation. Or whether you're ready to save yourself on your own terms by refusing to be fixed, by daring instead to be fully human. There is a silence that arrives after awakening, not the silence of sedation, but the stillness of truth settling into your bones. You walked into this exploration with questions society never wants you to ask, and now, standing at the edge of the illusion, you see it clearly. You were never the problem, your pain was never the enemy. Your desire to scream was not madness, it was honesty. What we call dysfunction is often just misfitting in a world that no longer fits the human soul. You have tried to make sense of your agony within a framework built to explain it away. But now you know, your grief is intelligent, your anger is sacred, your discomfort is divine resistance. Healing, if it's to be real, must include the world. Not just your inner child, but your outer reality. Not just your trauma, but the systems that compound it. So let this be the beginning. Not of being better, but of becoming whole. Not of conforming, but of remembering who you were before the world told you to adjust. You are not a diagnosis. You are not a broken system waiting to be fixed. You are a soul in revolt, a mind awakening, a spirit unwilling to go quietly. And in a society built on forgetting, remembering yourself is the most radical act of all. If this opens something in you, stay with us. Subscribe to WiseOga for more truth-infused psychology, philosophy, and rebellion of the soul.